Assalamu alaikum class. We were doing the terminal methods of contraception and we did the male sterilization. Now we'll proceed with the female sterilization. Female sterilization is done by tubal ligation, which is a permanent procedure of female sterilization. And in this procedure, the fallopian tubes are severed, cut, or we can say sliced, and they are sealed in order to prevent fertilization. Now, female sterilization or tubal ligation is done by two processes. It can be done by laparoscopic procedure, which is done by a laparoscope. The abdomen is inflated with gas like carbon dioxide, nitrous oxide, or air, and a laparoscope is introduced in the abdominal cavity to see the fallopian tubes. Now, when these tubes are accessible, fallope rings or clips are applied to occlude the tubes. Now, this short procedure requires a shorter operating time and a shorter stay in the hospital and a very small scar. But in selection of the patients, it's seen that postpartum patients for 6 weeks following delivery were not advised this procedure, and hemoglobin percent was also to be considered in this procedure, that it should not be less than 8, and any other associated medical disorder like heart disease, respiratory diseases, diabetes, that should not be present in such females who were undergoing this. So it needed some medical assistance as well. And there were very less complications along with this, and it's a very for popular procedure which is being done. Now, another type of female sterilization is done by mini lap operation. This is called mini lap technique, or it's also called Pomeroy technique. And it is also done under local anesthesia, and this is a modified form of abdominal tubectomy. It's a simpler procedure, and it can be done at primary health center levels, and it's very safe, efficiency is there, and it's very easy to do, and only a small abdominal incision is given, that is only 2.5 to 3 centimeters, and this procedure is done. Now, it is this type of procedure, this mini lap operation, or we can say Pomeroy technique, is suitable for postpartum tubal sterilization. Now we have finished the contraceptive methods. Now there is approach which is called the cafeteria choice. Now this approach is used in the family planning program of Pakistan, in which when the individual comes to the family planning clinic, that individual is offered all the contraceptive methods, and from those methods the person or the individual or the client, she or he chooses the method which that person needs and wishes to promote the family planning that he wants to do. Now, for cafeteria approach, a synonym is used, which is gather. G stands for greeting, like when a person comes to the family planning clinic, you greet that person. Then A stands for ask. You ask what that individual needs, what are the requirements. T, then you tell that person or the individual what can be done. H is for help. Then you help that client to choose. Then he chooses what he or she wants. Then you explain. E is for explaining. You explain the method or the contraceptive method that person has chosen, all the complications, the side effects, how it can be used, and all that. And R is for return. After that, you tell that client or that individual that that person has to come for follow up. Next, we come to the topic that how can you evaluate the contraceptive methods. Now, evaluation of contraceptive methods is very important. With that, we can assess the contraceptive efficacy. And the contraceptive efficacy is usually assessed by measuring the number of unplanned pregnancies that occur over a specific period of time of exposure and the usage of a contraceptive method during that time period. And two methods are usually used to measure the contraceptive efficacy. One is Pearl Index and other is the life table analysis. According to your syllabus and according to the examination point of view, you should know what is life table analysis and what is Pearl Index. I am not going to go into the detail of life table analysis as you must have done it in demography. Dr. Ira must have taught you about it. But just to tell you here that it is a better method of evaluation of contraceptive method as compared to Pearl Index. But in OSPI, you can be asked about the formula of Pearl Index. Now, with the Pearl Index, you can evaluate the contraceptive methods. And Pearl Index, as it is an indicator, is defined as the number of failures per 100 women years of exposure. And the formula for this is that failure rate per 100 women years is equal to the total number of accidental pregnancies divided by the total months of exposure multiplied by 1200. Now, the total number of accidental pregnancies should include every known conception, whether its outcome is a full-term pregnancy, live birth, or there is a stillbirth, or there is an abortion. And the multiplier is 1200 is the number of months in 100 years. Like in 1 year, there are 12 months. So 12 into 100 is 1200. And the denominator is the total months of exposure, and that is usually obtained by deducting from the period which is under review of whether you are taking pregnancy, then you have to take 10 months for a full-term pregnancy, or if there is abortion, you have to take 4 months for an abortion. Now, next is the calculation of contraceptive prevalence rate. Contraceptive prevalence rate is the percentage of women of reproductive age who are using or if their partner is using a contraceptive method effectively at a particular point in time, and it is always reported for married women. And the indicator is usually calculated by the formula that CPR is equal to the total number of eligible couples who are using a contraceptive method effectively divided by the total number of married females of childbearing age, and the multiplier is 100. And the contraceptive prevalence rate usually provides a measure of population coverage of contraceptive usage, and it takes into account all the sources of supply and all the contraceptive methods that are being used, and it is a most widely reported measure of outcome for family planning programs at the population level. And the contraceptive prevalence rate of Pakistan nowadays is 34%. Next is the unmet need for family planning. Now, this concept was first explored in 1960s when a CAP study was done on the contraceptives. CAP studies are the about the knowledge, attitude, and practices, and that showed a gap between some women's reproductive intention and their contraceptive behavior. Now, first you have to understand what do you understand by unmet need. Now, those women, married women who are sexually active and they also don't want to get pregnant, but they are not using the methods of contraceptive exception, or even their partner, or even if their partners are not using any methods of contraception. This is what is the unmet need for family planning. Now, this unmet need can be due to many reasons, like if the female or the family is uneducated, there is lack of education, or there is any lack of information about the family planning services, or if they have knowledge about the family planning services, the family planning services are not accessible. If they are accessible and they are they're going to the family planning clinic, but the services provided are not satisfactory and up to the mark, so they are not happy with the services, and so they don't want to use contraceptive methods. Or there is especially in our society, like in Pakistan, there is opposition from the husbands or even in-laws. So these are all the factors which are related to the unmet needs for family planning services. As you know, Pakistan is an overpopulated country, and the family planning program is essentially a component of our healthcare system. And it's the primary responsibility of the government to provide services. Now, the family planning services are provided at the public sector by the health department. The lady health worker or your LHWs, they work at the community level, and they provide your contraceptive devices like condoms, and they and your pills as well in the community, and they also give health education sessions, and they go door to door and educate the women. Now, the healthcare services regarding family planning are also provided at the basic health unit, your rural health centers, in your THQs, DHQs, and at the tertiary care hospitals where you have family planning clinics. Now, Population Welfare Department or PWD also provides family planning services, as they have certain reproductive health service centers. They have some training centers where they train the lady health workers, and training sessions are conducted, so how they can provide health education and do small procedures like insertion of IUDs. But usually IUDs are not done by lady health workers, but they only provide education in the community. And mobile teams are also present in the population welfare department, and village based family planning workers as well. And in the private sector, like FPAP is present, which is the Family Planning Association of Pakistan, which is the first and the largest association dealing with the family planning services. And they have some private NGOs working as well, like Green Star Social Projects as well. So these are the different projects which are working in Pakistan and providing family planning services. Usually, your condoms and some oral contraceptives pills are also provided free of cost in some of the centers, so that family planning services are promoted, and there less unmet need for family planning is present. This was the last lecture about family planning. Now I'm giving you an assignment in which you have to calculate the contraceptive prevalence rate and comment on it. And the other assignment is that you have to write a brief account about the ongoing family programs of Pakistan, and what are the different objectives, and what is the structure, and what targets have we achieved so far.